Well, my name is Mercedes Collins from Rasmussen College, and this will be my presentation on sickle cell disease. So I'll be going a little bit about what sickle cell anemia is. Basically, I've had a few family members and friends that have also been affected by the condition, and I just always wanted to learn more about it and pretty much figure out why exactly they've been in so much pain and the reasons for some of the causes and conditions of the disease. So I did find out that actually thousands of Americans each year are affected by sickle cell disease, and the population at most risk are actually African Americans. So 1 in 13 African American babies are born with the sickle cell disease trait each year. So how is sickle cell disease developed? Well, if you've never heard about sickle cell disease or anemia, you may be unfamiliar with how it's developed. It's caused by abnormal or S-shaped hemoglobin. This causes an issue in the body because normal red blood cells are usually round and biconcave shape, which make it easier for them to travel through blood vessels and arteries throughout the body. When red blood cells are irregularly shaped, the hemoglobin of the red blood cells are unable to carry oxygen effectively to various parts of the body, which causes the cells to stick to the walls of the vessels, and as a result can disrupt the flow of blood, causing tissues of the body to be deprived of oxygen. Here is an rendition of red blood cells with the sickle shape. So how do you get sickle cell disease? Well, unlike other types of anemia, which can develop sometimes over time or due to unhealthy lifestyle or just a deficiency, sickle cell disease is inherited genetically from parents and passed down to their children. This disease cannot, in fact, be transmitted from one person to another if someone has been diagnosed with sickle cell disease. So you only get sickle cell disease if, like I said, inherited from parents. And for those with sickle cell disease, the gene can be passed down, like I said, both biological parents. Other forms of sickle cell disease types include hemoglobin SC, hemoglobin thalassemia, hemoglobin SD, hemoglobin SE, and hemoglobin AS is a type where the gene has been passed down by one parent and therefore only have a trait for the disease and not actually experience many of the same signs and symptoms of those who have actually have inherited both traits from parents. So symptoms vary depending on the age, and severity depends on each client's case. So sickle cell disease can affect nearly all major organs and systems of the body. Major organs that are usually affected include kidneys, liver, gallbladder, heart, and even the brain. Sickle cell disease can cause certain other portions of the body to be affected as well due to the disruptive flow of blood to the bones and joints. Because of these certain areas of the body aren't getting that oxygen that are required. And here you can see in the photo of the sickle cell trying to get through this artery, and seems to be a blockage, and it's not delivering the blood how it should. So some more signs and symptoms. Common symptoms of sickle cell disease can include jaundice or yellowing of the skin, painful swelling and fatigue from the effects of anemia. Major complications of sickle cell disease can result in acute pain crises, which are pain episodes that have been described as sharp, stabbing pains that are felt at different times in various parts of the body, like the chest, legs, arms, or abdomen. And these painful episodes can be brought on by stress, dehydration, or even temperature changes. So there are some major complications that can develop from the disease. Sickle cell disease can cause major brain complications and can even cause clinical or silent strokes in certain cases. This can be caused by the blood flow to the brain being blocked or damaging the brain cells. Signs of a stroke include headache, weakness on one side of the body, difficulty speaking, or loss of balance. And another major complication we'll be going over is acute chest syndrome, which can be very painful for those affected and can even be deadly. For more information on acute chest syndrome or ACS, this occurs when the lung tissue becomes deprived of oxygen. The sickle cells actually block the blood flow. As I mentioned earlier, this inhibits the effective flow of oxygen to the lungs during those pain crises episodes. Children with asthma are also a population at high risk for having ACS, and a few of the symptoms that are usually seen with acute chest syndrome include high fever, some chest pains, coughing or wheezing, back pains, or rapid breathing. And another common major complication of SCD would be pulmonary hypertension. Pulmonary hypertension can be a major complication, as mentioned, which can also be a deadly complication. It actually develops when the pressure of the arteries in the lungs are increased. A lot of times this condition can go unnoticed because of the symptoms, just only shortness of breath, so that's something that can definitely go unrecognized in certain cases. Now, it is recommended that those diagnosed with sickle cell disease are given echocardiogram testing to ensure they are not at risk of pulmonary hypertension, as it can be so deadly. And if it is gone unnoticed, it can develop into respiratory failure or even death. Now we're going to go over some treatment types for sickle cell disease. So it's very important for those who are diagnosed with sickle cell anemia. This is usually can be diagnosed after a couple weeks an infant has been born, and that's when it would be recommended that you meet with a doctor or choose a hematologist to learn more about the disease and the different forms of treatment that you'll need in life to help alleviate any of the symptoms. Well, the treatment prevents further infection. That's definitely an issue those infected with sickle cell disease have to sort of be cautious of because they are at risk, a higher risk of infection with sickle cell disease. It also manages most severe complications. And some treatment methods include blood transfusions and drug treatment medications to help with the pain. So we'll go over the different types of blood transfusions. It's a key component of treating severe symptoms, and there's different types that are used for either chronic therapy or for specific pain crisis episodes. So there's simple transfusion. It's for non-severe instances to help with moderate anemia or fatigue. It usually involves infusion of 2 units of donor blood to restore blood volume levels and oxygen, as well as exchange transfusion used to prevent strokes and acute chest syndrome. This transfusion is done by drawing out the patient's blood while actually at the same time exchanging it with a donor's red blood cells. And then we have hydroxyurea. It's a treatment medication that will reduce pain crises and severity of symptoms among those with moderate to severe signs of sickle cell disease. It can be taken daily by mouth or as instructed by your doctor, and it does reduce the occurrence of strokes in children at high risk as well. They do seem to have long-lasting results, and there are a few side effects that have been presented with these medication includes nausea, drowsiness, hair loss, thrombocytopenia, and the reduction of red blood cells. As far as a cure for sickle cell disease, the only known cure as of now is hematopoietic stem cell transplant or bone marrow transplant, commonly used for children with severe symptoms of sickle cell disease. There are several side effects that may pose a threat, but it actually does have a pretty high percentage of success rates in children that have found a bone marrow match. It's not a procedure that's done as much for those affected by sickle cell disease because it is so difficult to find a donor, a perfect match donor for bone marrow to perform that procedure. Yeah, that's just a little bit on sickle cell disease. I hope I've helped inform you a little bit about this disease and condition, and thank you so much.